Good morning. Mary Ann Davis, University of Massachusetts Medical School. The point about how we can more rapidly take a look at some of the adult interventions, I just wanted to raise the possibility that rather than having to go out and test it actively, is to examine large research databases from the clinical trials that exist and look at age differences within the data. A lot of the PIs of those studies haven't asked that question of their data. And like NIH, for example, owns a lot of those databases. So it actually could be a very rapid way of taking a look at the existing adult clinical trials and looking for age differences in some of the outcomes that they measured.
Yes, I remember you were making that point yesterday in your presentation. I think that's an excellent plan because, I mean, it's very expensive to design randomized trials and so forth. So I think this is a very good point.
And the funding environment now is a bit tight.
Yes, absolutely. Thank you. Yes.
Good morning, Claire Brindis from UC San Francisco. I was wondering in your review how much ethnic and racial data there was available in terms of these interventions, because given the demographics that I talked about yesterday and others, I think it'd be really helpful to have a lens of racial, ethnic, as well as perhaps rural, urban, some additional elements that would be really helpful in thinking about also the phases of young adulthood. There's that immediate post-high school, early, post-college or not college, and then the transition into later adulthood. So those would be perhaps finer subdivisions.
Yes, I think that's important. I think it kind of depends on the program. I saw some programs that were very specifically focused on, let's say, African American young mothers in urban cities. So that was very much focused, and so it seemed like whatever the program was doing would also be useful for more general populations. And then there were some programs that were very broadly, at all college students. So I think you kind of saw a little bit of both. I think there was a parenting program specifically aimed at Hispanic young parents, for example. So there are some programs out there that are focused like that. So I think there's a lot of potential, but I'm not sure how broadly and systematic it is. Thank you. Great. Well, thank you.